Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Welcome to The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. You can connect with me, you can book a consultation to come see me, and you can do it all online at www.drshanibelgrave.com. I am super excited about today's episode. Today, we are discussing plastic surgery after bariatric surgery. I am delighted to have on the show today a plastic and reconstructive surgeon who's based right here in Atlanta, Georgia. The expert that's coming on today's show is Dr. Tomi Familusi. Dr. Familusi, welcome to the Coalition.
Thank you so much for having me. It's great to be here.
Thank you so much. So I'm really excited about today's show. I know we're going to get into a lot of good information. Let's get started by having you tell us a little bit about who you are.
Yes, for sure. So I'm Dr. Tomi Familusi. I'm a plastic and reconstructive surgeon here in Atlanta. I am originally from New York, but I trained in Philadelphia at the University of Pennsylvania. I specialize in aesthetic surgery of the breast, body, and face, as well as reconstructive surgery. So really cover the gamut of procedures that are offered by a plastic surgeon.
Wonderful. So in my specialty, which is the treatment of obesity, my focus is doing weight loss surgery to help people improve their health, particularly as it relates to high blood pressure, diabetes, sleep apnea, and a host of other ailments. However, patients have a legitimate concern about the transformation that their bodies will go through physically in terms of their outward appearance after their journey. One of the questions I get a lot from patients is excess skin. Can you start off by telling us, are there some myths surrounding excess skin, and what's kind of fact versus fiction?
Yeah. So just to touch on what you mentioned there, it's a legitimate concern. The transformation that happens with bariatric surgery, the physical transformation it's noticeable to everyone else, to you. And sometimes those changes can have really a stigmatizing effect on the patients that are undergoing them. The biggest myth, I would say, is that people think they can exercise away the excess skin. And unfortunately, that's not the case. Once the skin has become lax, or once the skin has lost its elasticity, it's really difficult to get that to turn back the hands of time with that. So really the solution is to remove that excess skin surgically. And that's where your plastic surgeon comes into play.
Okay. So can you give a little bit of information on what some of those options are for excess skin removal?
Yeah. So really, plastic surgery comes into play head to toe when it comes to post-bariatric body contouring. The biggest change that happens, as we mentioned, is excess skin. And now that can happen along the arms, along the legs. Most commonly, the changes that we see that are most bothersome to patients are in the abdomen. So excess skin, overhanging skin from the belly. Also, there are a ton of changes that you'll see in the breast for women, right? You lose a lot of volume, you have sort of deflated breast, and many women sort of lose some level of self-confidence when it comes to that. When it comes to your face as well, there are different changes that happen. It's a combination of laxity of the skin as well as loss of volume in the face. And those two things oftentimes will give a really aged appearance to the face. So after you sort of won this battle with weight loss and you see improvements in other medical conditions like diabetes or high blood pressure that you've had for a while, it's sort of now dealing with a different issue where your body doesn't look the way that you would want it to look, or you feel like you've aged significantly in the process of losing the weight. So specific procedures. So you can have an arm lift, which is called a brachioplasty, and that's where we remove excess skin from the arms. Sometimes people will call that, or more colloquially, bat wings. You can also have a thigh lift, which is removing excess or overhanging skin from the inner thighs. Tummy tuck is a procedure that's also done to address the abdomen. Separate from that is a paniculectomy, which I can go into detail a little bit about the difference between those procedures, because that's oftentimes a point of confusion for patients. Breast lifts, sometimes patients will opt to have a breast implant in addition to a breast lift to help give them some of that volume that they've lost. And then when it comes to the face, we're talking about neck lifts and face lifts and things along that line.
In terms of some of the facial rejuvenation, if there's a patient who feels that they've looked aged because they've lost some fat in the face, are there other options if someone doesn't want a facelift? Is there something that's not quite surgical that they may be able to do?
Yeah, so there are several different options that are non-surgical when it comes to facial rejuvenation, starting from Botox and soft tissue fillers. So Botox is a neuromodulator that temporarily will paralyze the muscles of the face to help deal with wrinkles. So temporarily, your wrinkles will be gone. Soft tissue fillers, on the other hand, are drawing in water into the tissues when they're injected, and that gives additional volume. These are things that are temporary changes. So oftentimes you have to do them on a regular basis to maintain your results. Soft tissue fillers, depending on where they're injected, can last up to a year. So that's really a good option for a lot of patients. And when it comes to recovery, when you compare that to surgery, these are minimally invasive procedures that can be done in a clinic setting, and really outside of minimal bruising, the recovery from those types of non-surgical procedures are very easy. You're kind of continuing on with your regular activities the same day. In the middle of that, we have skin tightening procedures when the degree of skin laxity or skin excess is not that significant. We have some energy devices that we can use to help tighten the skin. Some of those are Body Tight, Face Tight, Renuvion. So things like that are a nice in-between for someone who doesn't want to specifically have the recovery of a facelift. But again, the results are not as dramatic. So it's really best for patients who are sort of in between with their skin excess, and then you can deal with it with a minimally invasive procedure that can sometimes be done in the office.
That's fascinating. So is the best way for someone to figure that out to do a consultation so that you can kind of take a look and see what may meet their expectations and what matches? Okay.
For sure. Best way is to have a consultation. During that consultation, you'll be examined. We'll talk about your goals, right? Because there's sort of a give and take between what you want your results to be and what the amount of recovery that you're willing to undergo. So really, it's just finding a balance in what fits each individual patient, what fits into their lifestyle, and that's really the best way to address most patients' concerns.
So for something like a tummy tuck or skin removal from the arms or legs, can you give some information on what that recovery looks like?
Yes. So tummy tuck, skin removal from the leg, which is essentially called a thigh lift. I would say your recovery outside immediately after surgery is probably about 2 to 3 weeks out of work, especially if your work is pretty physically demanding. If your work is at a desk, something like that, usually by 2 weeks, you're fine going back to work. Although past that, there are restrictions on physical activity. So for about 6 weeks after surgery, you won't be able to lift anything heavy. So nothing more than 10 pounds usually. And you won't be able to do any strenuous activities. So exercise, anything that really involves like increasing the heart rate or a lot of sweating, you won't be able to do. I tell my patients you can walk as far and as long as you want, as long as your grandmother can keep up with you. That's the right pace.
Excellent. We love 30 minutes of daily exercise, so walking does count.
Walking is the way to go.
And then, as we talk about these different options, can you please give us some insight into the timing? Meaning, if you, depending on what you want to have done, is there a certain
Mhm.
order that things need to be done
Yes.
in?
Yeah. So oftentimes patients who've had bariatric surgery have excess skin in several different parts of their body. So they might want to address their breast, they might want to address their arms, they might want to address their legs as well, their belly. So multiple different things that need to be addressed. All these procedures can't be done at the same time for safety reasons, for the length of anesthesia, blood loss, several different reasons why all of these things can't be done at the same time. When I meet my patients, I usually have them tell me what their number one priority is. Like we make a priority list of what bothers you the most, what do you want to address first? And then that sort of gives us a framework with which we can then plan their entire surgical transformation, right? So we make that, and then we can combine certain procedures together because the recovery sort of makes sense. For example, it's really common to do a breast procedure and an abdominal procedure together. Oftentimes, just post-bariatric surgery patients, just a mommy makeover is any procedure that combines the surgery on the belly and another part of the body, which is usually the breast. So those are really figuring out what your priority list is and then picking the surgeries that work well together. So for example, you wouldn't necessarily want to do you might not want to do an arm lift with a thigh lift at the same time, right? Because now you're recovering with all four extremities and it's much more difficult to move around, to lift things. So your mobility is significantly affected. And with these surgeries, we always want to consider the risks of blood clots afterwards. So we're really thinking about how can we make sure that you are up and moving very soon after surgery. So arms oftentimes will be paired with a procedure on your breast. And then maybe a procedure on the legs can be done with a procedure on the belly. So really, it's individualized to each patient based on their priorities.
Wow, that makes a lot of sense, to make sure that you don't have impaired mobility because,
Yes.
again, we're always concerned about blood clots and things like
Yes.
that.
Exactly.
Speaking of risks, can you
Mm-hmm.
speak to the safety of these different procedures and what some of the risks are?
Yeah. So most of these procedures are very safe. Their complication profile is fairly low, but again, with every surgical procedure, there are risks, and it's important to be well informed about those risks before you decide to undergo surgery. So I talk to patients about the risk of poor wound healing. Right, these surgeries oftentimes come with really long scars, and body contouring is a trade-off between scars and better contour. So you are going to have a scar. Sometimes it's difficult to predict what your scar will look like, but we do various different things to help improve scarring afterwards, whether that's silicone sheeting or compression, different things. But ultimately, people want to know, what is my scar going to look like? So we talk about that. There's always a risk of bleeding with surgery. There's always a risk of infection, but there's certain things that we do in the preoperative period as well as the postoperative period to help decrease those risks. We mentioned the risk of blood clots already, and just making sure that the patient is up and moving very soon after surgery. I always say that the idea of bed rest after surgery is very antiquated, and most surgeons will agree that really, unless the surgery itself affects your mobility, we want you up and moving very soon after surgery. And
Absolutely.
yeah, and ultimately, we look at your part of preparing for surgery or optimizing you for surgery is looking at your medical history, whether that's diabetes, high blood pressure, cardiac issues. We try to make sure that those things are optimized so that your risks are as minimal as possible. And then really BMI is a huge predictor of risks after surgery. The higher your BMI is, the higher your risk of certain complications are. So we try to make sure that we're keeping patients between a certain BMI range or lower than before they undergo surgery. And sometimes that means that a patient will come in interested in surgery, and I'll let them know that, hey, you actually have to lose a little bit more weight so that we can get you to a safe BMI for surgery so that we decrease your risks as much as possible.
Right. So that body mass index, which is a
Yes,
number
exactly.
that's linking your height and your weight. And
Yeah,
so medically, my goal is to get all of my patients, after surgery, our goal is to get them less than 30, because we know that at 30,
yeah,
that's the marker for obesity where you have
yeah,
increased risk of health problems.
yeah.
So another question for you, Dr.
Okay.
Familusi. How do you determine, are any of these procedures requiring an overnight stay in the hospital, or are they outpatient?
So some of them can be outpatient, some of them are inpatient. If we're combining multiple procedures, we'll usually have you stay at one night in the hospital, really just for monitoring to make sure your pain is well controlled, to make sure that you're up and moving, and whatever sort of like immediate needs that you have after surgery are well taken care of before we send you home. If it's just one procedure or shorter procedures. So, for example, a breast procedure on its own or an abdominal procedure on its own, most they can be outpatient procedures.
Okay. Dr. Familusi, as a plastic surgeon, do you take insurance, or are all of your procedures self-pay?
Okay. Perfect question because everyone wants to know the answer to this. So, insurance will cover certain procedures. And I say that with the caveat that everyone's insurance is different, and therefore the procedures that your insurance will cover can be completely different. The one procedure that's usually covered by insurance is a paniculectomy, which is very different from a tummy tuck. But in general, for any surgery to be covered, any post-bariatric body contouring procedure to be covered by insurance, it has to be medically necessary. And when we say something is medically necessary, that means that we can show that there's some sort of functional limitation for the patient, or some sort of it affects their activities of daily living in some way. So whether that is their mobility is affected, or they have recurrent rashes, recurrent infections. But all of this really has to be documented over a period of time before insurance will cover it. So you have to seek out care for those rashes and care for the infections, and all of that is documented before insurance will cover it. There are each insurance company has certain requirements that you have to meet. You'll have to be a year and a half out from your actual bariatric surgery. You'll usually have to show that your weight has been stable for 3 to 6 months based on what insurance carrier you have. Some insurance companies actually have a BMI cutoff, and usually 33 is the most common number that we'll see. Liposuction is almost never covered by insurance unless you have a diagnosis of lymphedema, which is swelling that's due to issues with the lymphatic system, or lipedema, which is fat deposits, usually in the leg, that's resistant to weight loss. So those two diagnoses can get liposuction covered by insurance, but outside of that, you're not going to get liposuction covered.
Well, I gotta say that this was good information for me, because when
Yeah.
patients ask me, as they're losing weight, they common question, at what point should I see a plastic surgeon to have these
Mhm.
different areas addressed? I usually say that we want to make sure their weight is at their goal, so that things aren't
Yes.
still in flux and changing.
Yes.
But it's good information that you're saying that ideally you want to have a period where you've maintained that weight loss
Yes.
for a few months
Yeah.
before moving forward with plastic surgery.
Definitely. And what you mentioned of being at your weight goal is extremely important, because any significant changes in weight after surgery will affect your results, whether that's you developing extra skin, and now we've sort of gone through this whole surgery and recovery, and now your results are not as ideal as they would have been. So I tend to ask my patients that come in, what is your goal weight? And what's your weight now? And we'll plan for surgery when you're within 10 to 15 pounds of that, within that range. That's really because that amount of weight loss usually won't affect your results, but anything more than that, you're going to start seeing some changes.
Well, that's really important, because this is an investment that people are making in
Exactly.
themselves, and you want to get the most out of that investment and be happy with those
Yes.
results.
Exactly.
Well, Dr. Familusi, thank you so much for joining the
Oh,
coalition.
no
We have covered a
problem.
lot of ground. I'm hopeful you'll come
Yes.
back another time.
Yes,
What is
definitely.
the best,
Anytime.
absolutely, what is the best way for patients that need your expertise to contact you?
So the best way to contact me is directly on Instagram. So Dr.Familusi, Dr.Familusi on Instagram. And I respond very quickly. So everyone feel free to reach out.
Outstanding. Thanks so much, Dr. Familusi.
No problem. It was great talking to you.
All right. Well, thanks everybody for joining the coalition. I'm Dr. Shani Belgrave. You can reach out to me to get to that healthy BMI, www.drshanibelgrave.com. Thank you so much to Dr. Tomi Familusi. Thanks everybody for watching. Make sure that you share, subscribe, and share this episode with friends and family so that we can help transform lives. I'll see you next time.